Hey everybody. I just wanted to quick check in and talk about something that has kind of come up in the past couple of days, probably in the last week or two, and I had a few free minutes. So there was an article that recently came out called "The Vagina Whisperer Will See You Now." I know, catchy title, but it was kind of mostly about labiaplasty, or a doctor that's performing surgery on women to, shall we say, pretty up the area for really no medical reason. Labiaplasty or vaginoplasty is a surgery that we've been doing for years, decades, for things like prolapse and whatnot. But this particular article was talking more about women that feel uncomfortable with the way things look on the outside. And so this particular doctor charges thousands of dollars to fix this area to make it look good. And I was thinking, is this not a way to kind of almost say that women, again, aren't perfect? And of all places, the external genitalia, as it were, I don't know exactly what it's supposed to look like. If there is a societal norm, is there a cultural norm, kind of like what we do with women with their body shapes and their faces and their makeup? You know, I honestly think that this surgery is a symptom of something else. It's a symptom of men pressuring women to feel better about the way they look, even down to their external genitalia. So here's my thing. If things down there aren't perfect, if they're a little too loose, maybe it's not your problem as the woman. Maybe your husband needs to get a bigger penis. I mean, realistically, right? I mean, let's talk about this. Let's say, the guy who is in a delivery room when I was delivering babies, and he would be that, "Hey doc, you want to put an extra stitch in there for me?" And I used to think about this, and I say, the lady literally just had a baby. And he's talking about me putting in an extra stitch for him. So I would look at him and I'd say, well, no, I'm not going to do that. But I can send you to somebody that can make your penis bigger. And he would go, oh, I don't need that. But I'm talking, it's just stupid. It's like, so we have a doctor who's an OBGYN who's taking women and basically, in my opinion, preying on the fact that they are insecure with the way that they look. Now, you could say that maybe that's what plastic surgeons do, but if you're getting down to the point where you're changing the look of your external genitalia because you don't think it's small enough, or, the skin's too long on one side, I mean, that's a problem. I think that's a problem. And I really hope that this video goes viral because the P-shot, Jerry, is completely different, though. The P-shot is injecting so that, orgasms can be better. They're talking about doing cutting to do, he calls himself the self-proclaimed vagina whisperer. Well, if you're cutting and slashing on a vagina, that's not whispering, okay? That's mutilating. And so I just don't think that this type of thing is really getting the press that it needs. I mean, we're basically glorifying this guy who literally cuts wedges out of vaginas to make the opening tighter. Now, I don't know about you, but if sex doesn't feel good for the woman, how on earth, in most cases, is cutting out a piece of the vagina or stretching or shrinking the vagina with sutures and scalpels, how does that make things feel better? I don't personally understand that. I don't necessarily understand it as a physician. I don't think that that's why we do it. We do those types of surgeries to correct things like the rectum bulging into the vagina or the bladder's dropped. But to do it just for vaginal sensation, to me, is utterly ridiculous. And I think what it is, and I'm going to say it, guys, Jerry Bailey's here. He runs the Guy Show. We as men have failed miserably. We think that vaginas are supposed to look a certain way, they're supposed to feel a certain way, they're supposed to be a certain way, when the reality is, if you just spent about 3 minutes, well, not 3 minutes, that would be a long time, well, maybe 3 minutes, let's do 3 minutes. If you spent 3 minutes 3 inches north of the vagina, you'd probably get a much better response from your female partner than worrying about the way her vagina looks. And I'm talking 3 inches to the north. You've got something up there that most guys probably don't spend enough time on. But to send your woman to the operating room to make her vaginal opening, or her introitus, as we call it in the medical world, smaller, is completely ridiculous. And as men, we have failed. We failed miserably. It's disgusting. Now, I'm not saying this because I am this perfect human being or this perfect man, but reading this article and then reading the responses, it's really just been horrifying to me that women feel pressured that their vagina doesn't look right. I mean, I don't even know what the normal is for a vagina. Is there a normal for a penis, for a vagina? I mean, I don't get it. You know, my friend Anthony Yoon, who's America's holistic plastic surgeon, is a great guy, and maybe I need to have a talk with him. I know he doesn't do that area, and I have done labiaplasties, but I have done them for women who literally had a medical issue where the labia, the external labia, the majora was actually too big, and when she'd cross her legs, it would pinch, and so that's a problem. But it wasn't that, you know, I'm just doing these willy-nilly. This guy is cutting the vagina, he's trimming the vagina, he's trimming the labia, he's doing liposuction around the clitoris, which I don't even know what the point of that is. And this is all in the name of perfection. I don't understand it. And again, I'm a gynecologist. I could be totally off base here. But if I'm going to stick up and be an advocate for my patients, when they come in to see me for something like this, I really want to know why. I mean, I want to know why they feel they need to do this to themselves. And then ethically, is that something that I want to do as a provider? And if your insurance doesn't pay for it, it's probably because it's considered cosmetic and they don't think it's necessary. And 99% of the time, it's not necessary for the vaginal opening anyways. Now, there could be things like incontinence. There could be things like problems with, you know, going to the bathroom. And those need to be fixed. And I do agree with that. It's called an anterior colporrhaphy, a posterior colporrhaphy. It's a surgical procedure. But when we do those, we're doing it for a functional reason. We're not doing it for cosmesis. We're not doing it to make sure that your vagina looks great. Oh, hey, baby, your vagina's a 9 out of 10, let me tell you. It's not like this guy acts like he's a Picasso of the pubic area, the pubic Picasso. I don't get it, dude. I don't get it. But that's just me. So I'm going to write a rebuttal to this article, and I really want this to go viral. My daughter just came on, so that's pretty good. She's in the other room. So, but why? Why are we doing this? I want this to go viral. I want to push this out to as many women as possible because I want you to read the original article, and I'm going to post it here in the comments. And I want you to go to that article, and I want you to just speak your mind about it because the way that they wrote this article is kind of glorifying the whole process. And I just don't understand it. So let's do something. Let's talk to the guys, Jerry. Let's get the guys talking about the vagina. And why do we think that women are having this surgery? Why are women worrying about the cosmetic appeal of their lady parts? I don't know. Because I'm assuming most of the time you're wearing pants. It's not like you're walking around Black Friday, as it were, or whatever this is called, Pink Tuesday, Pink Saturday, I guess we're talking about vaginas. We're not walking around at the mall with our pants off. So why do we have to worry about the way that it looks? Now I'll tell you one story. I had this girl come in about 8-9 years ago who came in because she wanted things trimmed up a little bit, the skin, because her boyfriend told her that her penis, as he called it, when she stretched the skin out, was bigger than his penis. So I told her to find a new boyfriend. Okay? Don't say that. That's just not something you need to say, son. I mean, sir, come talk to me. I'll get you the right things to say. That's not one of them, okay? Just so you know. I mean, you don't want to do that. So that's it. Just wanted to check in. Just had to get that off my chest. If you would please share it, I really would appreciate that. Comment. Go read the article after I post it, and then I'll let you guys know when I post the response.